All right, let's talk about something you've probably seen on a lab report and maybe scratched your head over. That little acronym, ALT. What is it really? We're going to break it all down.
Yeah, you've seen it there, right? Just one of a bunch of abbreviations on your blood test results. But what does ALT actually mean? And what is it telling you about what's going on inside your body? Well, that's exactly what we're going to dig into.
So first things first, what is an ALT test? The best way to think about it is like an early warning system, specifically for your liver.
Okay, so ALT stands for alanine transaminase. It's basically a protein and enzyme that's found mostly, you guessed it, in your liver cells. Now here's a great way to picture it. Imagine your liver cells are like millions of tiny balloons, and each one is filled with ALT. Normally, maybe a tiny bit leaks out into your blood, no big deal. But if those liver cells get damaged or inflamed, what happens to a balloon? Pop. They can burst, and when they do, they release all that ALT into your bloodstream. And that is exactly what this blood test is designed to find.
And here's why this is so important. High ALT can be one of the very first signs of a liver issue. It's kind of like a smoke detector, right? It can go off and signal a problem way before you'd ever feel sick or notice any symptoms yourself. And that early heads up, it can be absolutely crucial.
Okay, so that brings up a good question. Why would your doctor order one of these tests in the first place? Let's get into the reasons you might need one.
A lot of the time, honestly, you'll get an ALT test without even really thinking about it. It's a super common part of a routine checkup. It gets bundled into a bigger test called a comprehensive metabolic panel. You might see it called a CMP on your report. This big panel just gives your doctor a broad snapshot of your overall health. And checking in on your liver is a key part of that.
Of course, your provider will definitely order an ALT test if you're actually showing symptoms that could point to liver trouble. We're talking about things like jaundice, where your skin or eyes get a yellowish tint, feeling super tired all the time, pain in your abdomen, or other pretty clear warning signs.
And then there's the monitoring side of things. You might also get tested regularly if you have a higher risk for liver issues. Maybe liver disease runs in your family, or you have a condition like diabetes. Even certain medications can affect the liver, so your provider might use the ALT test just to keep a close eye on things and stay ahead of any potential problems.
All right, so let's say your doctor orders the test. What actually happens? Well, the good news here is that the whole thing is super quick and really simple. It's just a standard blood draw. You probably know the drill. A health professional cleans a little spot on your arm, they use a small needle to collect a blood sample into a little tube, and that's literally it. Your part is done. The sample then gets sent off to a lab to be analyzed.
And when I say quick, I mean it. The whole process, from sitting down to getting a Band-Aid, usually takes less than 5 minutes. Seriously. The risk is next to nothing. You'll feel a tiny pinch, and you might get a small bruise later, but that's about it.
Now, there is one thing you might need to do to prepare. Because this ALT test is often part of that bigger panel we talked about, your provider might ask you to fast. That just means nothing to eat or drink except for water for several hours before the test. The most important thing here, just follow whatever instructions your provider gives you.
Okay, the test is done. Now for the part everyone really wants to know about. What do the results mean? Let's get into how to decode that number on your report.
So, here's a quick breakdown. Low ALT levels? Honestly, it's not very common, but it could be a sign of something like a vitamin B6 deficiency. Now, high ALT levels. This is where people's ears perk up. It may be a sign of liver damage, and that could come from a lot of different things. Infections like hepatitis, cirrhosis, or even just side effects from a medication you're taking. But I really want you to focus on that word may.
Because, and if you remember one thing from all of this, let it be this. Getting a high ALT result does not automatically mean you have a serious medical condition that needs treatment. It's not a diagnosis by itself. Think of it more like a flag, a signal that just says, hey, we should look into this a little more. So the first rule is, don't panic.
And why shouldn't you panic? Because a ton of different things can temporarily affect your ALT levels. Did you have a really intense workout right before your blood test? That could raise it. Your age, your sex, your weight, even where you are in your menstrual cycle can have an impact. Certain medicines, dietary supplements, lots of things can nudge that number up. It isn't always some big, scary liver disease.
So let's zoom out and put this single test into its proper place. An ALT result is never the whole story. It's more like one clue in a much larger mystery.
Your provider is almost never going to make a decision based on just the ALT number. It's all about context. They're going to compare it with other liver tests. You might see another one called AST, for example, and look at the rest of your blood panel. They're looking for patterns to get a complete picture of your liver's health.
And this is a really key detail to remember. The actual number itself doesn't tell you how much the liver might be damaged. So a super high number doesn't automatically mean there's a huge problem, and a slightly high number doesn't mean it's only a small problem. The level just doesn't work that way.
So when you boil it all down, what is the ALT test? It's just one piece of the puzzle. It's a really good piece, a sensitive clue that tells your doctor, hey, maybe we should look a little closer here. But it's almost never the final answer all by itself.
At the end of the day, your lab results are telling a story about your health, and understanding each part of that story, like what an ALT test really means, empowers you. It helps you ask better questions and have smarter conversations with your doctor. It puts you in the driver's seat. So the question is, are you ready to understand it?